AM 1450, FM 99.3, KNSI. Hi, this is Bob Hughes, and welcome again to another edition of Your Health. It is a program that we do locally with CentraCare, very important, because these doctors and nurses, all of the healthcare professionals that we talk with, are right here in central Minnesota. They know the things that you and I are dealing with. For example, our guest today is Cheyenne Orcutt. She is the supervisor at the Central Minnesota Child Advocacy Center. And Cheyenne, first of all, good morning. It's great to see you again.
Good morning. Nice to see you again.
One of the things that people may not know, the Child Advocacy Center. Tell me more about them. How long have you been around? Let's get a little history.
Yeah. So we started taking referrals in September of 2016. And what we do is we work with a multidisciplinary team when there is an active investigation of child abuse or child maltreatment. We bring together that team in one location so that the child doesn't have to go from agency to agency to get the services that they need. We provide some services not only to the child but also to their caregivers. And again, we do that all in one location, so the child only has to come to one place.
Now, when you say other disciplines, who are we talking about there?
So the other disciplines that make up that multidisciplinary team include child protection, law enforcement, our county attorney's office, medical, mental health professionals, and also advocacy.
So what has to take place before that child gets a chance to see you?
So what needs to happen first is that there needs to be a report of child maltreatment or child abuse. What then happens is that report is either screened in or screened out by the county, and Child Protection and law enforcement also cross-report that. So the child's initial safety has already been assessed, and it has already been identified that the child is safe where they're at or not safe where they're at. They may be placed in foster care or something like that prior to the child even getting to us. So the child's initial safety is assessed, and then a referral is made to the Child Advocacy Center.
Now, tell me, how's business?
We're busy.
Unfortunately, right?
Yes, unfortunately. We're glad to see that our community is utilizing us for these child abuse cases. But at the same time, it's unfortunate to see that there's been a quite an increase in our services. Well,
and yet again, you could say that increase is there because they know about you, right?
Yes.
Because what happened before?
Well, what happened before is children were shuffled from agency to agency to be interviewed about what had happened to them. Right. That led to them being interviewed sometimes multiple times at multiple places by multiple people. And if children needed a medical exam for their abuse, they would have to travel down to the cities to the next nearest Child Advocacy Center to have a specialist take a look at them and make sure that they're healthy.
So what happens when a child is asked over and over and over again to tell their story?
It re-traumatizes them. So not only have they experienced this negative event in their life, but they're asked to relive it over and over and over again. And really that just re-victimizes them and can really, that can be the part that's traumatizing to the child, not the actual event.
Right. But what happens if, a detail gets either forgotten or told in a different sequence of, timing or what have you? That could mean that case may get thrown out, right?
Yeah, so what's really important and what we do at the Child Advocacy Center, again, is bring that multidisciplinary team to the center. So when that child is being interviewed, the rest of the team is observing and they're asking the questions that they need answered so that one person in the interview, we're communicating with them actually via usually text message so that they can ask all of those relevant questions that everyone needs to know so that those details aren't missed and so that the child isn't needing to be interviewed again and again.
There is a new phrase that may not be familiar to a lot of folks, and that is mandated reporting. What does that mean, and who are these mandated reporters?
So mandated reporters are people typically that work with vulnerable populations. So that might be children, that might be vulnerable adults, people that sometimes need help caring for themselves. People that are mandated reporters in our community are people like child care providers, medical providers, law enforcement, teachers, counselors, all of those kind of professionals that interact or engage with children on a daily basis.
Is that fairly new in Minnesota?
It's not. Nope, it's not fairly new. I think we're attempting to bring awareness to it. I think people know when they're mandated reporters, but people aren't always given the skills that they need to make good mandated reports.
Yeah, good decisions and all of that. Now, you kind of chuckled when I asked you that if this is new, because I hadn't heard of it for probably maybe a couple of years ago. I learned about it.
Yeah.
And unfortunately, I'm not the only one, am I?
No, I don't think so.
AM 1450, FM 99.3, KNSI. We are talking about the Central Minnesota Child Advocacy Center. Our guest is Cheyenne Orcutt. She is one of the supervisors there. Cheyenne, I asked you earlier, how is business? And unfortunately, you said business is very, very good. We also talked about, what happened before you guys were there. Well, what happens now? Can you talk about the chain of events? The kids come in, they sit down, they talk with someone, they are interviewed. But what happens then after that?
So when a child comes in, they're usually accompanied by a non-offending caregiver. That might be mom, that might be dad, might be foster mom. When they are being interviewed, that family is actually getting some support by one of our advocates. And so they're talking about the criminal justice process with them. They're talking about victims' rights. They're talking about services and resources that we have in the community. And really just listening to them and kind of assessing how they're dealing with this situation. That actually extends as long as the family would like us to follow up with them, that support. It's a voluntary service, so if families don't want an advocate to follow up with them, we wouldn't. But they make a lot of referrals to community resources. So if that child is experiencing some trauma related to their abuse, or they're having some behavioral issues, the advocate can go ahead and make a referral to some mental health services for the child, and also for the family, because we know it not only impacts the child themselves, but it really has a dramatic effect on the parents sometimes, and other siblings, things like that. So it doesn't just affect the child, but that whole family it really affects. Following their forensic interview, we offer an exam to every child that we see. It can really provide some reassurance to the child that they're okay, that their body is healthy, that they don't have the physical issues to worry about. It can pick up on some unmet medical needs if there has been significant neglect or the child has not been seen in a while. It can pick up on those things. It also can really help the family with that reassurance and letting them know again that their child is okay. As I said, sometimes it impacts the family members just as much, if not more, than it impacts the child. And it can collect evidence for the investigation in some circumstances. So child does the interview, gets a medical exam, family is offered support and advocacy. And then the team members, the investigators, touch base with that family before the family leaves so they know what's happening, they know what's going on, and they have an idea of what they can do to support their child.
Is there a typical time frame that happens when that consultation, that interview, and all of this is done? Do they get there at 8 o'clock in the morning and they leave at 4 in the afternoon, or how does that work?
It's all sorts of times. Yeah. We really try to be flexible for what works best for the child and the family. So if we have a young kid coming in, we might not do it right at noon if they usually nap at noon.
Sure.
So it really depends on what works for the family. They're not there all day. Usually it's a couple of hours to get the full range of services that we offer. But yeah, they're not there all day, and we really try to be flexible to meet the needs of the family.
AM 1450, FM 99.3, KNSI. Chatting with Cheyenne Orcutt, who is a supervisor at the Central Minnesota Child Advocacy Center. You are listening to Your Health, and we'll be right back. AM 1450, FM 99.3, KNSI. You are listening to Your Health, and our guest today, Cheyenne Orcutt, who is the supervisor over at the Central Minnesota Child Advocacy Center. Folks, April is Child Abuse Awareness and Prevention Month, and we are talking about something that is tough to talk about. How do you guys do your job? My gosh, dealing with kids who are so fragile, so fabulously wonderful, and yet they've been damaged.
Mm-hmm. I got to say that our multidisciplinary team and the staff that we have there at the Child Advocacy Center, we're all very supportive of one another. Right. And so some cases affect us, different cases affect us differently, each one of us. So it is helpful to have a nice work-life balance. It is helpful to go home and see healthy kids. Right. And it's helpful to get out in the community and do things like this, to really work on the prevention efforts. Yep.
Very good. Yep. Very good. Now, There are, and we're going to be talking about things that are so foreign to me. There are 6 different types of child maltreatment.
Yep.
Part of my problem with all of this is that's so nice and clinical and clean, right? And this is the worst topic in the world. So let's talk about the different types of child maltreatment.
Yep. So as you said, there are 6. Those include medical neglect, mental injury, neglect, physical abuse, sexual abuse, and threatened injury. And most of what we're seeing at the Child Advocacy Center and most of why we exist is for the sexual abuse and physical abuse cases. We definitely see kids for other sorts of reasons, for neglect or kids that have been witness to violence, things like that. But primarily we are seeing kids who have been physically or sexually abused.
Okay, what happens in today's world? A child says, if you spank me, lay a hand on me, whatever, I'm going to tell whomever that you are abusing me, right? Mm-hmm. It's a typical warning thing that happens in today's world every day, right? Mm-hmm. How is it determined that this really is, in fact, happening to get those kids in to see you?
Mm-hmm. So that's where that screening comes in.
Okay.
So when someone makes a report to Human Services, they will screen the report and they will see if that does meet the actual definition per statute of child abuse or maltreatment.
Okay, so let's back up just a little bit. That would indicate to me that there may be some behavioral issues between mom, dad, and the kids, right? Mm-hmm. So can you toss a lifeline out to those people maybe could you tell them who they could speak with so that their situation doesn't elevate into, a full-blown case of child abuse or neglect or what have you?
Sure. Do you mean services that the parent can kind of seek?
And the kids, too, for that matter.
Yeah. So we work with some pretty great therapists out in the community who can help children in addressing behavioral issues and also work with the parents so that the parents can really help the child continue those skills at home, if that makes sense.
Yeah, and probably help themselves as well.
Yeah, absolutely. Yep. So as I mentioned earlier, we make a lot of referrals to mental health for both the child and the family. And so we would certainly help families get connected to that sort of resource, even if we don't see their child. They could certainly call us and we could talk about what resources there are in the community and hopefully get them hooked up with something.
Do you ever allow tours of your facility other than the one that you gave to the media?
Absolutely. Yep, we would love to give tours. Like I said, when we are out in the community or we have people visit the CAC, I think it just grows that awareness in the community and really, in turn, inspires its prevention.
Well, exactly right. And again, I had no idea until we visited the facility. And for those who don't recall, this past fall, the Central Minnesota Child Advocacy Center was the recipient of the CentraCare annual fall campaign.
Yep.
And again, we had no idea that this place even existed. Very thankful that it does. But once we got out there and saw everything that is done so clean, so professional, so caring. And I would have to think that, gosh, establishing that trust with that child again must be very, very tough. Is it?
Yeah, so we have a forensic interviewer on staff, and her job really when she starts an interview is just to build rapport with that child.
Right. So
to ask that child about, what are their interests, what are their likes and dislikes, things like that. And like you said, establishing that trust is a huge part of making that child feel comfortable and letting them know it's okay to tell us what has happened.
One of the things I think people may be thinking right now that this is a ridiculous conversation because this is not happening. It doesn't happen in our town, not in our community. Mm-hmm. Well, we have numbers in front of us, and numbers don't lie. Cheyenne, would you share some of those statistics with us, please?
Yeah, so in Stearns County, 2,021 reports of child maltreatment were taken in the year 2017. And in that same year, Benton County received 775 reports of child maltreatment. So we know that this is not just a state problem or a national problem. It is happening right here in our community. And those are the numbers of reports received. So if we think about the amount of children who don't disclose that something has happened, it's actually happening way more frequently than we even see in these numbers here.
Is it true that 1 in 10 children will be sexually abused by the age of 18?
Yep.
1 in 10?
Yep, and that's a national statistic. So there are actually over 42 million survivors of child sexual abuse in the United States right now. We know about the local problem, and then for statewide in Minnesota received over 84,000 reports of child maltreatment in 2017, and that number is increasing and continues to.
And again, these are not a ticked-off child who's mad at his parents. I'm calling the cop, right? This is the real deal. Mm-hmm. It's probably way underreported.
Absolutely.
Do you have any idea how many percentages would be?
I would say what we see in reports is only a fraction,
right,
of what's actually happening.
Right. All right. Now, we're going to get in our final segment today. We are going to find out about what we can do. Again, you don't have to be a mandatory reporter to see something and say something, do you?
That's exactly right. Yep. So anyone can make a report to Human Services or law enforcement.
Right. Reports
that are made in good faith. Those people can never be, for lack of better words, in trouble for making that report if it's made in good faith. And so it doesn't matter if someone is technically a mandated reporter or not. If they see something, they should definitely say something.
What is the Blue Kids campaign?
The Blue Kids campaign is a statewide campaign that was started a few years ago, I believe in 2010.
Okay.
And it's a statewide prevention and awareness initiative that CACs have taken. And the Blue Kids around the community, I don't know if people have been seeing them. They're kind of springing up because it's April, as you said, and it's Child Abuse Awareness and Prevention Month. But those kids in the community, those Blue Kid cutouts, stand for the thousands of kids that are maltreated in Minnesota every year.
We are going to break, and when we come back, we're going to get down to brass tacks, the nitty and the gritty about teaching your kids, teaching yourself what to do. What about the World Wide Web, which is a gateway to all sorts of wonderful things, but also some pretty bad stuff, too. AM 1450, FM 99.3, KNSI. Your Health on the Air. Cheyenne Orcutt is our guest. She is the supervisor of the Central Minnesota Child Advocacy Center. We'll be right back. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Cheyenne Orcutt is our guest. She is the supervisor of the Central Minnesota Child Advocacy Center. Definitely a tough topic today, folks. I hope you have something to write with and write on, because we are going to toss out some very, very important information. First of all, what should people do if they see something going on or they suspect something?
Mm-hmm. They should make a report to either the County Human Services where the child resides, or they can call law enforcement. Especially if it's an immediate safety issue, they should be calling law enforcement who can respond quickly. But they should be making that report regardless if they're a mandated reporter or not.
What can moms and dads do to make sure their kids are protected when moms and dads are not going to be helicopter parents, right? Kids have to lead their lives, right?
Yep.
What can we do to educate our kids?
It's really important that you start conversations early with your kids. Be open and don't assume that they know what safe and unsafe touches are. Mm-hmm. Have those conversations about safe touches and what the difference between a safe touch and an unsafe touch is. Certainly know who your child is spending time with. If your child is away from you and they're at a sleepover or another friend's house or something like that, know about who's in that house and make sure that you feel comfortable with the individuals who are spending time with your children. And then to also recognize and understand the signs of grooming. We can certainly provide more information if parents want to call us, but essentially if you're noticing an adult that's attempting to get your child alone or is spending additional time with one particular child, giving that child special treatments or talking about inappropriate things or having inappropriate boundaries with children.
What about the web?
Yeah, so there's some pretty scary stuff on the web, and kids are definitely vulnerable to being abused and exploited over the web. So know about what sites your child is visiting, limit their time online, making sure that you're having conversations with them again about safe sites and who they're interacting with over the internet.
Is it safe to say that kids are kids and you can be your kid's friend after they're no longer kids?
What do you mean by that?
Well, children need parents. Parents need to make tough decisions. Get in your kid's life. It is so important, right?
Yeah.
You can be their friend later when they're in their 20s and 30s and 40s and 50s.
That's a very good point. Yep.
All right. I have to ask this question, and folks, this may be very, very shocking, the youngest child that you have dealt with?
I would say a couple of weeks to maybe a month old.
The oldest child that you have dealt with?
Oldest child, I would say 18.
So when we say child abuse, sexual abuse with children happens literally any stage, right?
Yep.
We just talked about it. The youngest child that you have dealt with?
A couple weeks old.
Cheyenne Orcutt is the supervisor at the Central Minnesota Child Advocacy Center, and I have to ask you again, when we see something, what do we do?
You need to make a report. You need to call either law enforcement or human services and let them know, what you've seen. Collect, the necessary information from the child if they're actively disclosing to you. Collect the information that you need. Don't collect more than that, but collect the necessary information that you need and make that report.
April is Child Abuse Awareness and Prevention Month, but that does not mean that it shouldn't be taken care of 365 days out of the year. Watch for the blue kids, right?
Absolutely. Yep, they're starting to pop up all around.
Cheyenne, thank you so much for spending time with us today.
Thank you so much.
You have been listening to Your Health. Cheyenne Orcutt, the supervisor at the Central Minnesota Child Advocacy Center, AM 1450, FM 99.3, KNSI.